Good morning. Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine and Consultant Neurologist. Today I'll be discussing about the role of general examination in nervous system. Just like any other system, nervous system examination should also start with history taking, general examination and systemic examination. The important point to be kept in general examination, one is the pulse, blood pressure, respiratory rate, temperature, that is the vitals. Always look for neurocutaneous markers and examine for nerve thickening. We'll come to these one by one. First we look into examination of pulse. What is the relevance? So when you think about the pulse, start with the rate. Normal rate is 60 to 100 per minute. Rate less than 60 is bradycardia. So what are the conditions where you get bradycardia? So what we are talking is about the sinus bradycardia and not talking about the complete heart block. So it may also present as the complete heart block or the third degree heart block. The patient may come with syncope. So that should also be kept in mind. Bradycardia usually is seen in hypothyroidism. Patient is on beta blockers. These are the two conditions. But in a neurological problem, more important, relevant thing to be kept in mind is the Cushing's triad. What is Cushing's triad? Cushing's triad is, one is bradycardia, widened pulse pressure, and there is a systolic BP, diastolic BP, the difference will be high. So the BP will be elevated and irregular respiration. This is an evidence of increased intracranial pressure. So any disease that can relate on to increase intracranial pressure, like a brain tumor, subdural hematoma, following head injury, it is always very important to palpate the pulse, keep a watch on the blood pressure. In addition, whenever you get a regular rhythm, which is slow, lower than 50 or 40 to 50 range, think about complete heart block. So in complete heart block, there is atrioventricular dissociation. So the patient may present with giddiness, syncope, etc. That also should be kept in mind. Now we look about increase in the heart rate, that is tachycardia. Rate more than 100 is called tachycardia, more than 100. So again we are talking about the sinus tachycardia, any condition that increase the sympathetic activity like beta 1 stimulants, anxiety, hypothyroidism, pheochromocytoma, all can lead on to tachycardia. We are more interested in the autonomic neuropathy, especially patients with diabetes mellitus. They can have resting tachycardia. The reason is the heart rate is within the normal range because of the interaction with the sympathetic and parasympathetic. Sympathetic increase the rate, parasympathetic decrease the rate. When a diabetic patient develops a parasympathetic autonomic neuropathy, what happens? The sympathetic is not inhibited and the rate increases. So resting tachycardia is an evidence of autonomic neuropathy. And heart rate variability with the various conditions, this will not be there when there is a autonomic neuropathy. Another important condition is the POTS, otherwise called the postural orthostatic tachycardia syndrome. Postural orthostatic tachycardia syndrome. That is when the patient from the recumbent position goes up, they develop giddiness. That is due to sympathetic, that is due to autonomic dysfunction. This can occur following a prolonged illness, bed rest. So this is also due to autonomic dysfunction. Another thing is the vasovagal syncope. Here what happens? Because of the cardio inhibitory activity, the parasympathetic activity increases, and what happens? The heart rate decreases and blood pressure comes down. So it's a common occurrence, that is vasovagal syncope. When you are stressed in a particular situation, standing for a long time and seeing blood or seeing an injection, etc., you develop a giddiness and fall down. So a transient loss of consciousness this is a vasovagal syncope, and this again there will be bradycardia and hypertension. So next so we have discussed about the rate. Now we think about the rhythm. Among the rhythm abnormality, the most important is the atrial fibrillation. Any condition that leads on atrial fibrillation can lead on to stroke. So that is important. So here you can see the baseline is undulant. There is no P wave. The heart rate irregularly irregular. So this is atrial fibrillation. So again remember, when you are examining a patient with a stroke, look for atrial fibrillation. Minimum palpate for 1 minute, because patient may be on rate control medications, and so the rate may apparently appear to be normal. So that is about the atrial fibrillation. Next is the radial delay. That is when you are palpating the radial artery of both sides. There is a delay. So this can be due to various conditions like a thoracic outlet syndrome, this tachyarthrosis. Here again the more important condition you should keep in mind is dissection of aorta. So in dissection, what is happening? There's a false lumen. This may block the innominate artery, so that the subclavian and the radial artery on the right side can be weak and delayed. So because of the occlusion of the branches of the internal carotid artery, the patient may develop a ischemic stroke on the right side, leading on to left hemiparesis. So whenever there is a patient coming with a stroke, always remember, if it is preceded by chest pain, think about dissection, look for the radial delay. This is all the more important in emergency medicine. When patient comes with a chest pain, which is suggestive of a myocardial infarction, always palpate the both radial pulses so that you will not miss it. Now next we go to all peripheral pulses. It's important. Most important in the neurological case is the temporal arteritis or the giant cell arteritis or polymyalgia rheumatica, where you get a tortuous and tender temporal arteries. So biopsy is the gold standard. Nowadays Doppler study can also give a clue. So the complaint will be they can have visual loss, or they may develop visual loss. That is a dreaded complication of temporal arteritis. So the jaw claudication can be there. The ESR will be elevated. They may come with fever. So fever, elevated ESR, and a palpable tender temporal artery. Consider giant cell arteritis. Next is looking for carotid bruit. So all patients with stroke, you should also auscultate the carotid artery. So this leads, the bruit is due to nonlinear blood flow occurring at a stenotic region. This can be confirmed by Doppler study. So today we have discussed about the importance of examination of pulse and common conditions that you should not miss. So any patient with bradycardia, with giddiness, think about complete heart block. Any patient with a stroke, palpate the for 1 minute, don't miss atrial fibrillation. Always auscultate the carotid artery, looking for a carotid bruit in stroke patients. Any head injury, have a pulse BP chart, and see, you should not miss features of the Cushing's triad. And a rare case, a dissection, somebody comes with chest pain, don't miss dissection, or somebody with a stroke, especially left hemiplegia, always palpate both radial pulses. Hope it was useful to you. Stay tuned. Thank you.